Hello everyone, my name's Thomas and welcome to my presentation on the effects of resistance exercises on type 2 diabetics. So what is diabetes? Diabetes is a metabolic disease that affects how our body metabolizes glucose, also known as sugar. More specifically, it is a metabolic disease that prevents our body from using glucose properly. This can be due to multiple reasons, but in the United States, diabetes is usually caused by poor lifestyle choices or genetics, and usually those are referred to type 1 or type 2. And to the right, you'll see a little flow chart on how normal glucose metabolism is processed in a healthy human being. So you have increased blood glucose, which in turn makes the pancreas increase its insulin production. That insulin allows the uptake of glucose into various cells, such as your liver, your muscle cells, and your fat cells, and that in turn results in a normal blood glucose level. So as I mentioned, there are two types of diabetes that are prevalent in the United States. There are more than two actually. You have gestational, but that's not the purpose of this PowerPoint presentation. First you have type 1, which is an autoimmune disease. In other words, the body attacks itself. More specifically, the body attacks the pancreas, specifically its beta cells, which in turn results in very little to no insulin production at all because there are no cells to make it. Those who have this type of diabetes need to have insulin administered from an outside source. Most common forms of administration are insulin pumps or through a syringe. And type 1 is not curable, but it can be managed. Type 2, this one is known as adult onset diabetes. This one is due to poor lifestyle choices, sedentary behavior, poor dieting habits, basically an accumulation of poor habits. This one is the result of the body not responding to insulin despite the pancreas making it. This is because insulin sensitivity is almost non-existent, so it doesn't matter how much your pancreas is making. This one, unlike type 1, is not insulin dependent, so you don't need outside sources of insulin if you have type 2. And lastly, this type 2 can be reversed through proper dieting and exercising, as we'll see later in this presentation. So what is insulin? Put it simply, it's a hormone that's produced by the pancreas. More specifically, it's produced by cells in the pancreas called beta cells. This is, metaphorically, a key that allows cells, muscle cells, organelles to uptake glucose after you've consumed it. Without insulin, the sugars we consume from our foods never get to our cells, and as a result get stuck in our bloodstream, which can lead to increased blood sugar levels and eventually diabetes, which is also why you hear about diabetic patients getting their limbs amputated because their blood is so thick, there's no oxygen able to be transported in the blood, and eventually the tissue just dies off, so you got to get that cut off. So, the scientific article that we'll be going over is called Skeletal Muscle Microvascular Linked Improvements in Glycemic Control from Resistance Training in Individuals with Type 2 Diabetes. Purpose of the study, well, as I mentioned, was to find the effects of resistance training on those with type 2 diabetes. But we know exercise is good for you, so that's a very general objective here. But more specifically, this article goes over the underlying mechanisms on how resistance training benefits those with type 2 diabetes. The study also looks at other physiological improvements as a result of resistance training, like how else resistance training can affect your glycemic levels. Methodology and inclusions and exclusions. So with this study, it was a cohort study. There were 18 participants, 7 male, 11 female. All participants underwent a comprehensive screening before and after training programs in order to see progress, if there were any. In this comprehensive screening process, they underwent blood tests, body composition tests, and metabolic tests. Glucose tolerance tests were also administered to monitor insulin sensitivity before and after the training program. Training program lasts about 6 weeks total. Every participant worked out 3 times a week, with each session lasting 1 hour. Exercises included leg presses, lateral raises, weighted lunges, bench presses, squats, basically anything with weights. Moving on to inclusions. So you must be between the ages of 18 and 60. You must have a BMI between 19 to 35, and you obviously have to have type 2 diabetes. Exclusions. So if you participated in any physical activity that is resistance training or even aerobic activity, you're not allowed to participate in this study. You must not be a smoker or have any history of cardiovascular disease within the 5 years prior to the study, which includes hypertension, peripheral artery disease, and various other cardiovascular impairments. So after 6 weeks of training, the results were as expected. The biggest component to those with type 2 diabetes is the improvement in skeletal muscle microvascularization. You also see a significant improvement in body fat percentages, which is to be expected because all these participants were sedentary. Improvements in HbA1c levels, which leads to better glycemic maintenance. Improvements in lean body mass, which is because of weight training. Improvements in fasting glucose levels, improvements in total cholesterol levels, triglyceride levels, insulin sensitivity, and there was a slight improvement in blood pressure. What we didn't see an improvement was in LDL and HDL profiles, free fatty acid profiles, and resting metabolic rate. And if you look to the right, this image, it basically goes over the same thing, but it shows you how much the participants improved exactly. As you can see, blood pressure, plasma lipids, insulin sensitivity, HbA1c, and body composition, and how they progressed throughout the 6 weeks they trained. Conclusion. Well, we all know that exercise in general is beneficial. That's a given. But with regards to diabetes, resistance exercises seem to be underrated. Many people preach aerobic exercises, which are good, but the general takeaway from this is to exercise, alright? Because it's good for you, no matter who you are, aerobic or resistance. But with regards to resistance exercises and type 2 diabetes, the improvements were due to microvascular blood flow improvements, which basically meant more tiny blood vessels were made due to the increase of lean body mass, which allows the uptake of glucose, which allowed an improvement of uptake in glucose as a result from the increase in lean body mass. As a result of that led to a better glycemic control and may aid in reversing type 2 diabetes. So what does that mean for someone who's a clinical exercise physiologist, right? If I were one, I would say that resistance exercises aren't the only thing that'll work in combating type 2 diabetes. In fact, any exercising would help. There's no such thing as the best exercises, right? Because there just isn't. The best exercise is one that you will do consistently and enjoy, alright? Because if you don't enjoy your exercise, you're probably not going to end up doing it, which means you're probably not going to get the benefits from exercising. And that also means that you probably won't fix your type 2 diabetes. And here are my references, alright? Thank you.